So what I'm trying to do is encouraging myself and others to age healthier and better. And the team has put together a wonderful program. And one of the things is that we see hanging, lifting weights. And we talked a lot about this in the last year or so. Is the way I look at it, somewhere in your 30s and afterwards, you start to lose half your muscle mass by the age of 70 if you're not careful. And most of us have enough protein, and we're going to argue how much protein. But you know what? The most important thing is not how much protein you eat, which I think is one factor, is how much you're willing to lift and how much heavy stuff you're supposed to do. Are you going to do bends? Are you going to do push-ups? Are you going to do squats? Are you going to lift weights? And I think that is probably, and we'll hear about Dr. Attia and others are saying that that is the number one formula for longevity. Quality and durational longevity is that if you're not prepared to lift weights, you're not prepared to age well, according to Dr. Attia, and I believe him. So let's hear what the team has to say about this. So I'm going to start off with it. An apple a day keeps the doctor away, and lifting weights keeps you out of the doctor's office and keeps you out of the nursing home longer. Fire away.
So thanks, Dr. Curnew, for that introduction. First, we're going to start off kind of describing how resistance training actually works. So a quote that we found that applies to both life and muscle growth is that meaningful growth requires challenge and stress. So similarly, we go through challenges in our lives, and often we find that those challenges are what promotes a lot of individual growth. The same thing kind of applies with our own muscles. So in order to grow our muscles, we actually have to challenge them. So there's a diagram on the side here that I'm going to walk you through. But ultimately, when we are working our muscles, what happens is we have these muscle fibers. So think of them as like long straws. So that first picture up there is that long pink straw. So for us to grow that muscle fiber and to make it bigger, we have to challenge them. And that's done through things like resistance training, which exposes these muscle fibers to stress. And when muscle fibers are exposed to stress, what happens is microscopic damage occurs. So if you can see on the second picture there, the tube little straw has almost little cuts in it. And that's the damage that happens when we resistance train. Now, often we think of damage as a bad thing, but it's actually a good thing in this case, because what happens is when we are resting, the cells in our body actually work to fuse those damaged muscle fibers together to form new muscle protein strands. So what happens then is through this damage and repair process, our muscles actually grow in size and in strength. So you can see comparing the first straw at the top before exercise to after recovery and adequate nutrition to the which is the last one there, you see it's a lot bigger because it went through that process of being damaged and then repaired. That's ultimately a very simplified version of how our muscles actually grow.
Alrighty. Well, thanks for that, Haley. I also wanted to talk a little bit about why muscle mass matters. These two figures are very, very important. You can see the strength decline by decade, 42% reduction from the ages from 40 all the way to 80. And actually, it depends on the person, but after the age of 70, 75, those impact can actually be quite dramatic as well, where people lose a lot of strength, a lot of muscle mass. And actually part of the reason is actually on the right side here. There are periods of inactivity. In the pandemic, we have had a lot of that, people getting sick with COVID, flu, 1 week of bed rest, you lose a lot of muscle mass. There was actually this idea that we're going to share that some people lose their strength and muscle mass in acute phases where something bad happens to you, you lose a lot, and something else bad happens to you, you get injured, and over time you lose more and more strength. So you can see in ICU admissions, 2% muscle mass loss per day. That's quite dramatic. So you have to take this very seriously. You want to minimize injury, minimize periods of inactivity as much as possible, and that's one of the reasons not to get COVID. Because even people who are younger, you're in bed for a week, or you're inactive for a week, less active for a week, and that puts you behind in terms of in terms of if you actually are exercising. If you're not exercising, it puts you behind in terms of your muscle mass.
Well, that's kind of interesting is I like this number. You lose 2% of your muscle mass per day if you lie in bed. Is that right?
Yeah,
And it's also age dependent too as well.
yeah, yeah.
Um, and older people lose it quicker compared to younger people, and younger people get it back compared to older people. And I was listening to something. I think thank you for sending that podcast about space travel about calcium loss. Do you remember about that as well? Is that going into space?
Oh yeah,
Um,
yeah. You lose a lot, and a lot of astronauts that come back, they don't get, some of them don't get it back, and they're not, they're very fit people.
I can't remember exactly, but I think being in space for 6 months is the equivalent of losing, is it 10 years or 5 years or a number of years of I'm not sure muscle mass or calcium. I can't remember the actual details, but gravity is important.
Yeah.
Um, and so people who go into space are really spending a lot of time with their fitness. And so I think sitting and watching or lying in bed and watching TV is a good way to lose calcium, muscle mass, and brain function. So these correlations are strong. Now I noticed you have these different things, RF, BB. What are those little numbers there?
Good question. Actually, I haven't looked into this. I have to look the
I
citation again. Yeah. I think
think it
it
could
probably
be,
different contexts of different
yeah,
people.
or just individuals, I think.
Yeah, yeah,
These are individual people that have done that. I remember
yeah.
reading some studies where they took young people, put them to bed rest, um, and how quickly they lose muscle mass. And then older people, and you mentioned, of course, that you can tell about illness. When you're in illness, when you get sick, you need reserve, and if you don't have reserve, you may never make it home again and never recover. And that's one of the reasons why people who have hip fractures have such a high mortality, because they start off with little reserve. They have weak bones and may never recover. And what I remember, if you have a hip fracture, you have a less than 50% chance of really getting back to your normal self. And there's a very high mortality, somewhere between 20 to 50% the next couple of years. Mm, so so keeping your muscles alive is good. Tell us more.
This is just another idea of wanted to share this diagram here. You can see the punctuated decline, and just to reiterate, the key takeaway is that folks, especially if you're starting out with resistance training, I know Dr. Curnew, you can tell us a little bit about starting with somebody and not doing it alone. Now, I'm not going to suggest that that's going to be a barrier to people. They should not start going to the gym or pick up weights or anything like that for fear of injury. Uh, I think Dr. Carney, you've seen me mention injury risk a few times, but it's definitely a factor in terms of putting people back. Periods of bed rest, COVID, you have to take it seriously, because especially when the age, if you or your loved one is in that age group where they're already at risk of sarcopenia, which is muscle loss related to age, it's just, you just have to keep a closer eye on that individual to avoid any falls. You just mentioned falls as well. So you can see the top left, there's normal decline, and then there's events that can be part of your control, that you can do something about it.
So now we're going to kind of get into the effect on muscle strength and growth that resistance training has. So if we go to the next slide, we're just going to talk a little bit about why muscle strength is actually important. So when I think it's one more back.
Yeah, there you
Yes,
go.
perfect. Thank you. So when we think about muscle strength and exercising, there's a lot of benefits that are more than just kind of that physique or physical appearance that some people may associate with exercise. It actually impacts all of our body systems in a very positive way. So for example, exercise, specifically resistance training, can do things like increase bone density, which will help prevent fracture, help lower fracture risk, as well as it helps reduce risk of falling. It also helps improve lipid profiles and reduces blood pressure. And it also helps with cognitive function. So it helps our brain work to connect thoughts, and also it impacts our mental well-being as well. But specifically, there's actually more benefits for resistance and strength training, and these benefits actually increase as you get older. So one study in particular looked at older adults who actually struggled with walking, and they separated them into two groups. One group was completing just stretching at home, so just completing some stretches, whereas the other group completed a weightlifting program, and they did that 3 days a week for 3 months. And what they found at the end of the study period was that the weightlifting group actually had improved lower body function by 7%. So what that meant is that in that 3 month period, one of the measures that they used to test this was how well they could bend their knees and kind of touch the ground and then stand back up. So what they found with the people who were actually completing this weightlifting program were able to bend their knees and lift up with a lot greater ease compared to the only stretching group, but also compared to where they were initially. So they felt a lot more comfortable doing that. And in addition to that, they also experienced a reduction in activity limitations compared to the stretching only group. So what that meant is that people are actually able to continue doing the things that they enjoy and take on new activities they were interested in, whereas the stretching group really didn't see that effect. So what this could mean is that actually building muscle strength it's more to do than just becoming stronger. It can help our bodies function a lot better, but also help us stay active and keep doing the things we love doing for longer periods of time.
Well,
So
I think, Haley, you bring up some good points. One of the most important things is that getting muscles stronger, exercises reduces joint pain. And that's something. Look, I have this cane over here, and I overdid it. So I was in Aruba, did a week of kite surfing. We did resistance training, high interval training, and we went to this local gym. Made sure I did my 12,500 steps a day. 2 hours of kite surfing lessons every day. Came back, went to work, played hockey on Friday nights, played squash on Sunday morning, and played double squash on Sunday morning after Saturday morning. And I went plane gliding. And as the day went on, I got this pain in my hip area, and that night I couldn't sleep too well, and I was really quite sore, and took a cane for a day, and went today for thank Dalton at Dundas Physio. He took a look at things. He made me do some more exercises. We did upper body. My pain's feeling better. Nothing serious about this, but I can just lie around in bed and get sore, or I can start moving around. So you have to find that just enough motion to keep things moving, and not too much to aggravate it. So I have spasm in some of the muscles in my rear end. You can say maybe someone gave me a good kickback there. But it's, and management weightlifting. We mentioned about one of the things is deadlifts. I have to be careful because I've overdone things. My wife is ripped a hamstring muscle by overdoing things, but I think in general, learning to do these things, and as you get older, you don't repair yourself as quickly, but you also can look at all this, look at all the benefits here. So when people say I can't exercise because I'm sore, is you're not exercising enough and not doing the right exercises. So most people can just walk around in a pool, and I just see so many people at the gym I go to, they just walk in the pool to start off with. Tomorrow I'm going back for a little bit of some weight training, probably more upper body, but my thighs feel a little bit better, and so what? I overdid it a little bit. So what? I'd rather overdo it than underdo it. But look at all these benefits here. So I don't know why this does not become a bigger priority for most people. It is so undervalued. People say I want to do things with diet, lifestyle changes. This is a great lifestyle change. It's a game changer. It's probably the single most important thing you can do to have good quality end of life. Most of us will end our life with illness. The last 2-3 years, of many people you'll be sick. Not everybody, but most people. But by doing these forms of muscle training, building muscle, you push that later. You live longer and you live better. period. So I'll shut up for a little bit and walk around with my cane today.
Thanks, Dr. Curnew. So when we get down to it, and it's how we want to actually know, how does resistance training actually impact our muscle strength and growth? So a key definition we want you to keep in mind is something called a 1 repetition maximum. So what this means is it's the heaviest weight you can lift once while you're using proper technique. So what that means is that it's the max amount of weight you can do, but while ensuring that your body is in the right position for that exercise. So a really good way to kind of figure this out is just through trial and error. When you are doing trial and error, you want to make sure you are paying attention to that proper form, because like Dr. Curnew said, it's quite easy to get injured making mistakes on that form. So what you can do is kind of work your way up. What I usually do is I start at around 10 pounds and then see if I can go to 12.5 and then 15. And then if there's a 17.5 weight, I'll try that. And then 20 and so on and see what is it that I can do one complete rep. And then the moment I can't do one rep anymore, that's probably where I'll stop and go back a little bit so I can do those complete sets to make sure I am not being able to complete the sets without being able to burn out. So it's really just trying to get to that maximum amount of weight you can lift. So when we're thinking about that, it's also a really good way to measure muscle strength in research. So what we found here in 2 studies was, the first one was that among older adults, what they found when they compared resistance training alone or in combination with aerobic training, what they found was that resistance training in both settings actually increased maximal strength for up to 37%. So people got a lot stronger when they were resistance training, and muscle mass also increased by about around 3.4 to 7.5%, and muscle power increased by about 8.2%, and then functional capacity, or the ability to actually do activities, increased by up to 58%. So what this shows is that resistance training can not only help, again, us build up the strength, but it also can help us in a lot of different areas like movement and things like that. And then what a really important thing to keep in mind is that the effort level matters in resistance training. It's very much a you get what you put out. You get what you get the you know what I mean. When you put in the work, you get the outcome. So what they found was that comparing heavy loads to light loads, a heavy load, so closer to that 1 repetition maximum, actually helped in gaining strength. So it helped increase compared to light loads by 35.4% increase versus a 28% increase. And that growing muscle, and in growing muscle, which people were lifting heavy loads had an 8.3% growth, while people lifting light loads had a 7% growth. So what this whole slide is trying to tell you is that try your best to do the weights that are the most challenging for you, that are also the most practical for you. And as you get stronger, you'll notice that your 1 repetition maximum is going to build and build and build. And that's a really good way to also see your progress as you go through resistance training. So if we go to the next slide, I told you all about kind of how to kind of look at resistance training and what to do, but how do we actually plan our resistance training schedule? So I found 2 studies here, and they kind of give a little bit of a leeway of how to actually plan what training we're doing. So what research found is that high frequency, which meant 2 to 3 days a week, training the major muscle groups, so things like your arms, your legs, your back, had a greater effect than lower frequency, which is about 1 day a week on muscle growth. So what this means is that if you train arms only 1 day a week, you might not see the same impacts as if you split it up and maybe train it twice a week. So what they do recommend is that you train your major muscle groups at least twice per week. And when you're doing the training, you try to complete about 1 to 3 sets of about 6 to 12 reps at about that 30 to 70% one repetition max intensity. And again, a really good way to figure that out is through trial and error. There are some calculations you can find online if you are a math person and want to get into the statistics of it. But my mechanism that's always worked for me is that trial and error method. And as you can see down here, we kind of mapped out maybe like an example schedule of how you can plan your week. So as you can see, this person would only be resistance training, but incorporating kind of maybe aerobic activities on their days off, but they'd be resistance training 4 days a week. And you can see that they're doing arms twice, back twice, chest twice, and legs twice. So just because you're training one major muscle group doesn't mean you have to just spend 1 day training that. You can kind of mix and match there. So what I really like to do is incorporate things like legs and chest. Those are 2 different places on my body, but it's a good way to make sure I'm doing more than just training these major muscle groups once. I'm trying to get to at least 2 to 3 times to make sure I'm actually building up that strength. So if we go to the next slide, I told you all about kind of resistance training, but it's nice to see kind of the long-term effects on how resistance training may affect our muscles. So when adults aged about 62 to 70, and there was about 419 of them, so it was a pretty big sample size, were randomly put into 3 groups, and they completed a 12-month resistance training program. So the 3 groups were heavy resistance training, and these are the people that used weight machines or dumbbells. You had moderate intensity resistance training, which include things like bands and body weights, and then you had the non-exercise cohort. And what they found was that this heavy and moderate intensity resistance training were pretty productive in increasing lean body mass, which means that you're kind of getting thinner, and muscle strength and size. But specifically, they found that those people who are using those weight machines and dumbbells actually found the best results because they're kind of challenging their bodies a lot more, going back to that first slide we covered. So what they found was that people who are in the high and heavy and resistance training group had more lean body mass, higher muscle strength and size, and also a lower fat percentage and fat content, which is really important when we're trying to get into those health values, because these things can really impact a wide spectrum of different systems in our body. And what they found when they looked at follow-up 1 year later, they found that the people who actually continued exercising did a pretty good job at maintaining that muscle strength and size and that lean body mass. But when people stopped training, their lean body mass muscle strength and size went down. So what this whole slide is trying to really drag home is that consistency in resistance training is really, really important, because stopping resistance training can actually lead to reduced strength, increased fat, which really emphasizes the need for ongoing resistance training when we're trying to get the health benefits and maintain those positive results.
Thanks for that, Haley. And also just add on to that, we don't want to make it sound too grim. There was actually a randomized trial in this, I think it was in Denmark, published this past summer. They took a group of I think around 400 individuals, average age 71. So that's very applicable to many of our patients in the clinic. Hopefully, some people watching this or people, family members in your 70s or 80s. And that is actually not too late. They had them do heavy resistance training, emphasis on heavy. They really made them work for about a year, and up to 4 years later, you could still see some beneficial effect. Now, their measurements, they did body composition, and they measured the actual strengths with machines, with leg strength. That was their gold standard that they used. But the key takeaway is, try, when you're doing resistance training, I think we have touched on this already, the idea of repetition max. Try to get close to that failure or fatigue. There's evidence to say that you always don't have to necessarily go to absolute failure, because some people underestimate their failure. It might be 15, but some people really give up at 12. As long as you're getting close to that consistently over time, And again, for most people, that's not the issue. Most people is actually doing it. But if anybody's interested, just get close to that area. Don't think too much about overworking yourself. Just get close to failure, close to fatigue, and they will get optimal results. And the results last a little bit as well when if you put the work in. So it's a little bit like investing. You invest today and you reap the rewards later as well. The money doesn't go away. The muscles don't go away completely.
So what happens when we actually stop resistance training? Again, going back to that, consistency is key.
Go back
And
go back one slide. So here's an older couple training. Just go back one slide. No, just those.
Yeah, I know there's just an internet delay. I know, yeah, 1 second.
Sorry.
There we go.
So you can see this older couple looking after themselves. So let's say Mrs. Smith gets breast cancer, or Mr. Jones has a heart attack, and now they need chemo, radiation, being in bed rest. You mentioned they lose 2% of their muscle mass per day. Um, they built reserves so they can actually go home and live longer and better. So that's the whole thing. You mentioned that putting money aside, long investments. This is an investment in your health because unfortunately, most of us will have illness at some point in time, some setbacks. But if you come into your illness when you have lots of reserves, it's much easier to bounce back. And I see so many people that their daily lives are exhausting. They're tired, they're short of breaths, they're weak, they can't do very much. They get sick, nursing home time. And their life is pretty, it's pretty bad. And so I don't know why you want to do this. The other thing too, there's some data that for older people, there's one trial we talked about doing a year of this resistance training didn't translate to benefit. Or in a younger person, it did. They did 2 years to show the benefit. So it just makes sense. As I get older, things are harder. I get it, but I have more time to do it. I'm smarter. So I hope you're smarter too to think about how this fits into your life. Is that so important? And you feel better. Look, I feel the best when tomorrow morning I'm going to be doing some resistance training at 6 to 7 o'clock in the morning. Um, I'm not going to have anything to eat or drink except for coffee until sometime in the afternoon, and I'm going to feel euphoric for a few hours tomorrow morning. And I wish you all had that same feeling too as well. And I think it's so important. Tell us more about the what happens to our muscles there.
yeah, so basically what happens is let's say you go through this really long process of resistance training, you build up a lot of muscle strength, and then you just stop. Basically what happens in this case is that our bodies are programmed to continue building and using things when we're actually using it. But if we stop doing these things, our body says, what's the point of putting energy towards that? I'm going to divert it to something else. So in this case, what happens when we stop resistance training is we actually lose muscle tissue, which is called muscle atrophy. So if you can see on the diagram here, this normal muscle is a lot more plump than this atrophied muscle because that atrophied muscle was not being trained, so it got a lot smaller, which means it lost a lot of strength. And this can lead to things like weakness, trouble balancing, issues with daily tasks, and some muscle twitching and cramps. So to actually make our bodies more comfortable, continuing resistance training is actually really important. So one study found that older men who did about 8 weeks of strength training, older men who stopped doing about 8 weeks of strength training lost about 25% of their muscle gains after they stopped for 2 weeks. So that shows how important it is to maintain that consistency, very similar to how we need to continue using our brains or else our neurons are going to die off. The same thing is going to happen with our muscles if we don't start using them and consistently building that strength.
All right, we also wanted to share some ways to get started. What are some ideas? There's actually different ways you want to load the muscle. Some of them we mentioned right now was actually about weights. So we have free weights, we have machines. We're going to talk a little bit on the next slide as to what the pro and cons are. In terms of injury risk, if you're a beginner, which one of these should you start with? Some people say machines because you have the right form. And it's just easier to do for some people. I mean, because the form, and also you can control the weight. Free weights a little bit more challenging for some people. Some people say the injury risk might be slightly higher. Again, different people are different, but also body weight push-ups are amazing for special people who, if you're able to do it. There's something called knee push-ups where put your knees on the floor and do a half push-up, build some strength there. So you don't necessarily need to have body weight. Um, to have free weights. Body weight is also a very good start. Body weight squats, especially for people some just starting out. Again, Dr. Curnew, I was going to ask you, when you started your resistance training, did you start without weights first? What did your personal trainer tell you to do? To just get the form correct and such? Or
Yeah,
there,
he
what was
was
there guidance?
well. Yeah, I have no flexibility, so when my wife sees me exercise, she thinks I do it improperly. But when I work out with my group, either my squash buddies or the people we do the resistance program with, is that I just try to extend for what I'm doing, and um, it's just trying different things and feeling that comfort zone and really try to go to exhaustion. One of the things is that um, I love bench pressing. It's one of those fun things to do, but it's nice to have somebody, uh, be there because you want to be able to do that last couple. And if someone's not there, yeah, I don't want that weight to be on my chest. So it's having some fun. Um, and you know, uh, I really never thought about whether I enjoy it or not. I think it's fantastic. Um, I'm euphoric.
Most
I hope
important is doing it, right? What you're doing.
yeah, but doing it right and carefully. And today I had my hip problem, and so so we changed the program today, and I felt really good, and I'm moving around better, and I'm anticipating a very short recovery phase, like we always do, but we'll see what happens. And so I look at all these young people, and I see some old people doing it, and we all need to do this, and at your own
Absolutely.
level.
Just some other ideas. There's also resistance bands. Some people recommend that as well. Again, it depends. Some people find that the resistance that they have is good enough for them. If you already have some level of strength, resistance bands might not be ideal for building muscle. Um, it depends on the person. I don't think we can make huge generalizations, but these are some ideas. Also, wanted to talk a little bit more about these are wonderful. For just as a start, squats, push-ups, pull-ups, anything, any variations of these. There's easier variations of these. You don't have to. Some of these might be challenging for a lot of people. Just do whatever you can and build some momentum and go from there as well. You have isometric as well, planks. So many to choose from. There's a lot of information on the slide. Is more of a disadvantage and advantage diagram of different resistant modalities. So anybody interested, please pause and take a picture of this, and take a look. But you can see that some of the pro and cons for the machines. Great for beginners. It's safer, adjustable, beneficial for people with neurological conditions. Again, lots of different characteristics of different modalities. So just take a look at this, see what's right for you. There's some examples of them. There's lots to consider. Also, credit to credit where credit's due. This was taken from a wonderful YouTube channel called Exercise for Help. We also have a picture of that later as a very great resource that we're going to share in a little bit as well. All right. Just going to skip this one. It's more of an adjunct. Try to pull the next slide. All right, let's talk about protein now. Before this, there we go. So part of resistance training is actually protein. When you're trying to build muscle, the first requirement is to actually put resistance on the muscle. Second is actually the building blocks of the muscle, which is protein. And so something happens as you age, something called anabolic resistance. In English, it means that it becomes very more difficult compared to younger people to put on muscle, to build muscle. So you can see some of the causes right here. We're not getting into the details, but this is what happens. You can see bottom left, the same person, to build the same amount of muscle, they need a greater dose of amino acids, the building blocks of protein. So it's quite important. Now, there's a lot of talk about how much is enough. There's something called the RDA, the recommended daily allowance. If you look at the Government of Canada website, for people above the age of 18, the recommendation is as below. It says 0.8 grams per kilogram of body weight. However, there's a bit of a controversy about this. A lot of people doing research in protein metabolism interested in what is optimal instead of what is normal, and what is the bare minimum, recommend higher levels. We have that in a rectangle here. They recommend 1.2 grams for people who are athletes trying to build muscle, maybe a little bit higher. Again, individual variations for people with chronic kidney disease. Please speak with your doctor. It can be a little bit different. Another caveat is that these recommendations here are for total body weight. And Dr. Stuart Phillips, actually at McMaster, talked about should we actually use your ideal body mass, and he said actually yes. If you are overweight or obese, you can probably use your ideal body weight, and actually that is where your BMI, or your body mass index, falls anywhere from 21 to 23, and you can estimate that way. This is just a little bit of an introduction to protein. If you want to learn more, we have resources that in the description on this. The key takeaway, however, is that if you want to build muscle, protein is very important. More important for someone like Dr. Curnew when you're a little bit older than myself, where it's way more difficult to put on muscle. So something to consider. It's a building block. There's that saying that you work in the gym, but the protein is built in the kitchen. So food really is important. Now, there's talk about what is the best source of protein. Lots of information here. But if you look at observational studies, it was actually the nurse's health study. I think it came out this past May. That was an observational study showing that plant protein was actually favored to animal protein. But let's just quickly give you the pro and con. So all plants have the essential amino acids. So let me just backtrack. What are essential amino acids? So amino acids are building blocks of protein. There are 9 of them that are essential that you need from food. And so animal proteins have it very readily, but also plants have it as well. But in order to get the whole composition, you probably need a little bit of variety when it comes to plants. So we have some ideas on the left here. There's lots to choose from. And the other consideration is something called bioavailability. In English, it means how much of it is digestible. There's a lot about some people who are not fans of plants. Those people, they say that, oh, it's not as readily digestible. But the evidence seems to be that vegetarians, vegan, they can get exactly the same amount of protein. You cook it and you solve the bioavailability and digestibility issue to a great extent. And there's also protein supplements. We're not going to get into the pros and cons of that, but that's also an option. And that's actually good important to note as well, that 100 grams of chicken is not 100 grams of protein. And so it's actually not super easy to meet these recommended amounts of 1 gram per kilogram of body weight, 1.2. So for some people, these shakes, whether they're in isolate proteins, blends, are definitely a tool in the toolbox. Some people recommend them. Again, we're not going to recommend anything broadly here, but consider them. Also brands, if you can get them from a whole food, that's actually the ideal thing. But for some people, a bit of an extra booster is definitely necessary. It's like a Zetamib on top of Crestor, you could say. But Dr. Curnew, what are your thoughts on best source of protein, soy, eggs?
Well, I think if you want to look from a planetary perspective and an environmental perspective, beans are the best source, and soy is a very complete protein, very bioavailable. get a lot from peas. You get and different nuts and things of that nature as well. So if I had to pick the best source of protein on the planet for health, environmental, um, greenhouse effects, environment, animal welfare, beans. So I'm trying to, and actually beans give me an Ozempic-like effect in the sense they make me feel full. So I'm trying to have a half a cup to 1 cup of beans every day, different varieties. I'm lucky I live on a farm, so I have lots of beans, and um, so I here's a little something from just from my farm. It's kept for a couple of years. I just add them to everything. My son loves quinoa, so I made me some quinoa. I put in the freezer, put into different soups and things of that nature as well. But if you want to build muscle, I guess, and you want the best bioavailable, Dr. Tanapowski talks about egg whites and skim milk as being the best source of um, protein to build muscle, but I think you can do it all sorts of ways. So your choice. There's controversy about beef, especially processed and like things like bacon. I think of bacon is a cancer on a stick, so to speak. It's a type 1 carcinogen. I'm basically eat very little meat at this point in time. I do eat fish, the fatty fish. I hope will help my brain health as well, but um, I'm trying to probably, as I get older, my tendency towards diabetes is becoming more problematic. So I'm trying to actually, I like this idea about 1.5 to 1.6 grams per kilogram to build muscle, better for metabolic health in the sense for diabetes. So I think these are all good things. I'm not into these shakes or powders. I'm into real whole foods, and all these selections that you have here are wonderful. Um, and there's all these micronutrients we get from grains and from vegetables that we don't even fully understand. So I'll give you an example: beta carotene, which is orange, found in carrots. And if you supplement with beta carotene, it's been shown that you actually increase the risk of lung cancer if you're a smoker. But beta carotenoids were 300 groups of molecules are protective to the immune system. So we have lots to learn right now. So I don't think it's you have so many choices here. Any thoughts from anybody else?
Just want,
I'll
yeah, go ahead, Haley.
Oh, I was just gonna give my perspective. I s- I identify as a very picky eater, and I recognize that is one of my downfalls. But I think for me, when I was really trying to prioritize protein in my diet, I really looked to recipes on the internet. So I would type in things like high protein soups, high protein chilies, and just looking at ways that you can make things like beans, which originally was something I would kind of not really eat. Um, find ways that I make sure I like them. So it's really important to do that, but also making sure that when you're doing it in a health conscious way. So one of my favorite things to do is make chili, and I try and do that by getting things like low sodium canned tomatoes rather than the full sodium canned tomatoes, and making sure that I add in an extra can of beans into it just so I can get a little bit more protein, a little bit more fiber that way. So my biggest suggestion would be really try and experiment with foods, even if it might seem off-putting originally. Like if you're not a bean person, I guarantee you there's a recipe out there that you're going to love, that's going to make you love beans, and then it can become in your weekly rotation a really good way to incorporate more plant sources of protein.
Wonderful. Now, there's also another idea of leucine. Leucine is an amino acid that's very important when you're trying to build muscle. And a good analogy for it was that it's a very good ignition. It's the ignition of protein synthesis, especially if you're trying to build muscle after workout. They've tested when you give some people more leucine up to a certain point, um, the protein synthesis goes up to a certain point. So the idea is, would you want to increase that in your diet as well? Again, this might be too much nerd speak for us to try to maximize one amino acid specifically. We would talk about whole foods as a whole. The previous slide is better, but if anybody who is more interested, this is a table showing how some of the sources of leucine highlighted from highest to lowest. Cottage cheese, 2.5 grams. We have animal sources here. We have plant sources, beans, lots to choose from. Dr. Curnew said, lots of variety. All right, Haley, take it away with a training guide.
Yeah, so we wanted to end off the webinar today with maybe a little suggestion or maybe some homework on how you can actually start incorporating resistance training into your life. So we want to provide you with a little guide, and we wanted to make it as easy as possible. So I remember I was quite intimidated when I started going to the gym and started incorporating resistance training into my weekly schedule. And so a way I kind of combated this was making it as simple for my mind as possible, because what I'm really trying to challenge is my muscles. So what I typically do is I kind of work on a 4-week rotation, where for 4 weeks I'm completing like the same exercises for every like day of the week. So for Mondays, I'm completing things like a full workout, a full body workout. On Tuesdays, I'm focusing on legs and abs. Fridays, I'm doing arms and back, and then incorporating aerobic exercise throughout the week. So this is a way that I found it's been quite easy for me to know, okay, I'm at the gym on a Monday. These are the exercises I'm going to work through. But then throughout each week, I'm going to increase the kind of challenge of it. So for example, what we have here is each day, we have it set out where you're doing resistance training for about 3 days a week. And then each day you're doing about 6 exercises and then incorporating a kind of cool down cardio activity, which can be any of your choice. My personal favorite, I do like doing like an incline walk on the treadmill or doing sprints. It's just my way to keep my body moving. But each day I'm working not only one muscle group, try to get at least 2 to 3 in there, and making sure I'm using those big movements. So things like squats, things like chest presses. You really want to make sure when you are working out, you're working those big movements that incorporate a lot of muscles or the big muscles. And then as you kind of get a little bit more into it, you can find those small exercises that work those little muscles and incorporate those throughout your exercise routine. So this is a good kind of start off thing to incorporate if you're not sure where to start. And then in combination with that, on the next slide, we kind of have little benchmarkers that we can work up to. So for example, your challenge for week 1 is to find whatever weight makes you really work for your last rep. So hitting as close as you can to that one rep max. And then you're going to complete 3 sets for 8 reps, or about 30 seconds if it's like a plank or something like that. And then you're going to do a 60-second rest between each set. Then the second week, if you can, we're going to want you to increase the weight by a factor of about 1. So for example, if you're on a machine, they usually have like the needle that you pull out and pull to a bottom one. You're going to try and increase it to the bottom one. But if you struggle to do that, that's okay. You can then increase it by doing a few more reps. So seeing if you can get to 10 reps, 3 sets of 10 reps, and then continuing those 30 seconds each. And then for week 3, you're going to increase it to 12 reps, or try and increase it again by weight, and then also increase the time to about 40 seconds each for those exercises. And then by the 4th week, you're going to complete 3 sets for 12 seconds or 60 seconds each, but you're going to decrease the rest between them to make your muscles work a little bit harder. Or again, you should increase the weight. But by that 4th week, you should be finding that you will need to increase that weight to make your body, because your body is getting used to that challenge and wants more challenge. But when we are doing these resistance training exercises, we do want to keep 3 things in mind. The first is focusing on form over weight. Especially if you are starting out, it's really important that you're mastering how to do the exercise itself instead of trying to do things, a classic term is called ego lifting. So it's when you think, oh, I can lift 50 pounds, but then your form is out of whack, and that can actually lead to be a higher risk of injury. So really try and focus on that form. There are so many YouTube videos out there and that really teach you how to do it. And there's so many mirrors in gyms, and you can even, if you're working out at home, work out beside a mirror so you can make sure that you're doing that proper form. The second one is incorporating more rest if you need it. So the week we planned out is a good way to start, but also if you recognize that, let's say your body needs an extra day to rest, that's fine. You can always shift it because you have those extra days, because you really want to try to make sure you're not going to injure yourself, because if you injure yourself, it's going to be harder to go back to resistance training, and it's going to take you a longer time to recover from that. So really prioritizing rest, because that's also how your muscles grow. And last, but certainly not least, is if you are ready to take it to the next level, challenge yourself with heavier weights. Please, please, please take every opportunity you can to challenge yourself, because that's how you're going to grow and become stronger and really take advantage of resistance training. Instead of just kind of focusing on weights and stuff, we also included a few YouTube videos that are really YouTube channels that are really helpful. So on the next slide, we have this YouTube channel here. It's called Yes to Next. They really kind of blew up during COVID, but it's a really good resource that you can turn to. And then on the following slide, we have Exercise for Health, which is another really great resource to incorporate, that you can use to incorporate it. And if you are kind of wanting a little bit more information, you can look at the following resources, where a lot of the information from our webinar came from ideas from these podcasts. And then certainly last but not least, we also create exercise videos on our YouTube channel. So you can do that by going to Dr. Curnew's YouTube channel and searching for exercise. And there's a bunch of exercise videos. We did recently do one for arm strength exercises, to kind of build that upper body strength. And then if you want to kind of start making resistance training a habit and want some support, we also do have our Wednesday group, the 3Ms group, that meet every Wednesday at 7 p.m. on Zoom. And you can always let Dr. Curnew know if you're interested in participating in that during the next visit. But that kind of concludes a bulk of the information we had for the webinar. Brad, I'm not sure if there's anything you wanted to highlight or go back to.
No, that's it. I think we just also wanted to share this again. Anybody wants to learn more about protein, you can check out these two webinars. Links are in the description as well by Dr. Stuart Phillips, the faculty in McMaster, actually, very close to home. Dr. Peter Attia, that one at the bottom. That was a wonderful source of information, exercise for aging people, where to begin, and for a little bit for protein intake for Dr. Loke Van Loon, anybody who's interested. The links are in the description for curious people. Take a look.
I also want to emphasize is that balance training is really important as well. So as we get older, risk of falls, we lose our vestibular system. Many of us will have tremors, and one of the exercises I do after I get out of the shower is I try to lift up one foot and put one sock on without not falling too much. And the wetter the sock, the more I've ruined so many socks by tearing them. But it's part of my exercise training. And I think those are important things as well. So, Haley, one of the things that when I'm doing my resistance training is that is it important to by using more power in the sense of just doing things faster versus slower? What's the advantage of lifting those weights more gradually, slower, or trying to generate more power, and also the extension versus the flexion parts, and people talk about that too as well. You want to comment on that as well?
Yeah, that's a really good question. From my understanding and the research I've done, I think it matters what your goals are when it comes to it. So a lot of people, like let's say the bodybuilders and the people who really want to kind of get those bigger muscles, they'll more focus on actually like really slow movements. Whereas people who are doing things like marathons are doing the exact same exercises, but they're just doing them quicker because endurance is more important for their muscle, for training their muscle. So it kind of depends, I guess, on your goals. A really good way to do it is, or at least what I do it is, I know my legs are stronger after so many years of playing soccer than my arms. So when I'm working on my upper body, I try my best to do those slower movements because I find that helps me get stronger in that area. But for my legs, I kind of focus more on those endurance because I do have that strength in my legs. And when it comes to it, I want to also work on making sure my leg muscles can last longer if I am going for a run or something like that. So it's kind of, you don't have to do one or the other. You can kind of adapt based on what your preference is, but also kind of what makes you feel good too. That's kind of my suggestion with that and that information. I'm not sure if, Brad, do you know anything further on those points?
Nothing further specific, especially with the full extension or not. But I think the most important thing is for strength, you pick a slightly heavier load but lower reps. For muscle synthesis, hypertrophy, so to speak, it's about the number of loads and also how many times you do it. So consistency really is the key. Um, you mentioned marathon runners. I've looked into that a little bit. So for runners, they pick heavier weights, lower reps because they focus more on strength rather than for hypertrophy. But if you want to be a bodybuilder, get a bigger muscle, you need protein, of course, but you need a lot of reps as well. Not as heavy, but a little bit more reps. That's my understanding. In terms of putting more power and force over great area, etc., time, I'm not sure. I think those two factors are probably more important. That might just be something at the top that we have to ask a bodybuilder about.
So what the take-home message for me is that most of us get enough protein, but if you really want to maximize it, somewhere close to 1.5 grams per kilogram. One thing we didn't talk about that is, the timing of the protein. It really doesn't really matter throughout the day. Many of us are developing diabetes, and I think there's a lot more emerging data about time-restricted eating. So what I wish I can do is eat from 8 to 4 every day, 8 in the morning to 4 at nighttime. I am terrible about that. I'm a nighttime eater, and the healthiest way to eat is not to eat 3 hours before going to bed. I'm eating as I'm falling asleep most of the time. But what I've done now is that after going to bed somewhere between 10 and 1 o'clock, I will try not to snack anymore, and try not to eat till the next afternoon, sometime after 12 or so, and drink coffee. Now, one of the interesting things about my coffee, I like to sip it and microwave it and nice and hot, is I used to put oat milk in it. I like the taste of oat milk, but I'm learning that oat milk is a rapid source of release of carbohydrate into the bloodstream. So I'm trying to put that with either milk, usually skim milk from my perspective, or almond milk, or any form of nut milk, adding a little cinnamon to that. And I just sip that. But I really feel the best if that I exercise first thing in the morning, quite intensely, and that I basically just have water and coffee. Not, I mean, I'm not saying I drink. I'm always have a cup of coffee, but I'm sipping it and microwaving it. So I'm having, somewhere between 2 to 4 cups of coffee during that time interval, and I feel euphoric, and I never thought I'd feel this good. But I'm going to try to switch that around there, and so I want to thank you guys for such a wonderful presentation. I'm not sure if Dr. Wharton is on YouTube. If he is Brad, is Dr. Wharton still on YouTube there?
Wonderful
And if you want to,
question. I can take a look.
and so again, or if not, we're gonna actually do a few push-ups before the end of the night again. So
Yeah, go ahead while you do that. I'm
okay.
gonna do it in a little bit as well. So let's see. Tranche, Dr. Wharton.
Anybody on YouTube right now or not? That's okay. I'm just gonna, Haley, you can do some push-ups tonight.
I'll try my best. My floor is quite slippery. I cannot speak today. Slippery.
All right.
But I'll try my best. I'm not the best at push-ups.
I'm not either. So Brad always beats us at, okay, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 25 and a quarter. Ugh, can't get past that there, Ed.
At least you're consistent with going to the failure is always 24, 25. I just did 25 as well.
Alrighty. Oh, that was fantastic. Oh, catch my breath. And I want to thank everybody for doing this. It's wonderful, Haley, Rad, and all the other team that helped out. I'm out of breath, and we're going to talk about in a few minutes from now, I think, if it's about new ideas about weight reduction. So I'm really enjoying this time-restricted eating. I'm really enjoying this high-intensity exercise and just trying to build muscle. And it's taking a long time. I don't know if I'm working on body composition as well. So I want to thank everybody and have a great night.